Well, we can speak to Danny Mortimer now, who is the Chief Executive of the NHS Confederation. Hi, Danny.
Good afternoon, Gloria.
Good afternoon. I'm good, thank you, and I'm very pleased to be speaking to you. So I want to start by asking, are we seeing anything like the pressures on the NHS that we saw in terms of COVID admissions at the moment?
I think it's fair to say that our members are starting to worry that we will do soon, Gloria. I think particularly when we talk to colleagues in the Northwest and Merseyside, they have seen that kind of rapid increase in admissions of COVID positive patients that you touched on in your introduction. At the same time, there are a couple of, I suppose, more positive things to emphasise. We do understand the virus better. We understand some treatments in terms of minimising the severity and impact of the virus, and we've got trials that are ongoing in terms of improving our understanding there. So our clinical teams are better placed. We've got more confidence, I think, in supplies of PPE and availabilities of treatment and equipment as well, which give us a bit more confidence. But of course, this has been an exhausting 6 months for the teams in the NHS and for our friends and colleagues in social care as well. So that's something that we're really keeping an eye on, because we've got to support our people as we move forward.
Because just a regular winter puts pressure on the NHS, but with fears of that second wave coming too, it must be a great worry. I mean, for a start, how do you make sure that people are in separate areas? Because obviously, people will have to go to hospital. Yes. It is the winter, and you don't want them getting COVID.
No, and teams across the NHS now are trying to balance three things. They're managing COVID positive patients, they're responding to the winter, and they're trying to maintain non-COVID services. That safety for patients is paramount, and there are all sorts of things going on. People have been really innovative in terms of how they've used their spaces so we can keep COVID positive and non-COVID patients separate. Organisations are partnering together as well, so sharing waiting lists, sharing facilities and staff. Patients might need to travel a wee bit further to get a non-COVID treatment, but actually they'll be getting that treatment in an area that's much safer. And clearly today as well, the NHS is launching a campaign particularly focused on potential cancer symptoms to encourage the patients to come forward, to reassure the public that they can help us help them by contacting us if they are worried about symptoms, by speaking to their GP. And there are all sorts of things we can do to keep them safe in the months ahead.
Are all NHS staff working on the front line? Because testing was a big issue at the beginning of this pandemic. Is it now routine for staff to get the tests that they need to make sure that they can do the work, and we need them at work clearly?
So it is routine since September for staff in social care to have regular testing, though I know
the testing,
our colleagues
yes, but the time that the test result comes back is a problem.
Exactly. That's a particular concern for them, and clearly social care settings were very problematic in terms of the spread of the virus and impact on residents. NHS staff don't have the same regular testing as their social care colleagues. What we're looking for is a much clearer arrangement with Test and Trace and with the government, where NHS staff can be prioritised for that access to treatment consistently across the country. We don't want to be reliant on local arrangements. We want that very consistent commitment, so that if staff need to be tested, identify that need to be tested, they can get priority to do so, because we clearly don't want to, our capacity is obviously a function of the buildings and equipment we have available, but most importantly, it's a function of the people we have available to look after patients.
I think most people listening, certainly I include myself in this, I think I'm quite shocked that it's not routine for somebody who works in the NHS on the front line to be tested very regularly.
Where we find ourselves at the moment is that it's a function of the capacity that's available within Test and Trace. One of the key thing that Test and Trace has to do, we're not there yet, is suppress the virus in the wider population. That means there's a balancing to be done in terms of the capacity that's available for all of us in society. And as I said, what we want is a much clearer set of arrangements where NHS staff can be prioritised if there's a need identified. personal circumstances or whatever it may be. But that probably is the best that we can do right now. Moving forward, as the test and trace situation is improved, then let's see how that might improve things. But that priority does seem really important to us.
Yeah. You did give us some good news, because obviously PPE, on the lack of it, that was a huge feature of that first wave. Yes, but the government has nailed that. There is no problems with PPE for NHS staff this time around. Is that
everything? Fair? Yeah, everything we've heard about the plans, in particular the kind of massive growth in terms of domestic production of PPE. I think we've gone from something like less than 5% of PPE being manufactured in the UK to more like 3/4 of PPE being manufactured in the UK. Gives much greater resilience to the availability. We saw particular problems in terms of distribution of PPE to our smaller kind of facilities, primary care, social care, and community services. So we still need to see that works better going forward. But it does feel as if the plans are much more developed, much more resilient than they were 6 months ago.
Well, that is good to hear. And just to ask you about waiting times for routine hospital appointments. I mean, really big numbers now. What can we do about that? What do the government need to do about that, or what does the NHS need to stop those waiting times rocket?
So we're members of mine are doing a huge amount of work. They've restored a lot of elective work over this last couple of months, albeit there's obviously some risk to some of that as we go forward and deal with the pandemic. We're working with patients to prioritise waiting lists. And also to give some patients some choice about delaying their treatment if it's not urgent. We're obviously emphasising the messages as well about speaking to your GP if you've got symptoms that you think might be an indicator of something serious. But dealing with that growth in long waiters is something that's going to take, frankly, Gloria, a couple of years to resolve. And that's the bit where the government need to help us. Looking forward, we need to have sustained investment in giving us the extra capacity, the extra kit to be able to deal with that backlog in wait. So I know it's a real area of concern to staff working within the NHS. They don't want their patients waiting as long as we're now seeing, and we're getting back to the kind of waiting times that we worked really hard to address in the first 10, 15 years of this century, and we just don't want to go back to that at all.
And just to bring you back to what we started talking about, and you mentioned that hospitals in the northwest were, there were areas of concern in terms of preparing for an increased number of patients. Do you think we could see anything like we saw in the April peak in our hospitals?
I think it's really hard to say. I mean, we're obviously all hoping that we won't, that the government can take measures next week, and that the population can cooperate and support those measures so that we can slow the spread of the virus. And that rapid acceleration you talked about in your opening remarks is the big area of concern in this last 2 weeks, whether it's in Merseyside or in Nottingham or wherever it may be. We need to slow that rate of progress of the virus, and that hopefully then helps the NHS cope with the demand that it's seeing. As I've said, the NHS itself is in a much better place. It's learned, our fabulous teams have learned an enormous amount about managing the virus, about how they can work together across organisations as well to do that. But that clear action by the government, and our compliance as a population with the guidance that we've been given are really important steps as well.
Danny Mortimer, head of the NHS Confederation, thanks very much for your time this morning.